Next, he's the CEO of Solve.Care, experienced in blockchain, finance, technology, and healthcare, and has held various roles with various companies over the last 26 years of his career. Put your virtual hands together for none other than Pradeep Goel. The floor is yours, sir. Take it away.
Thank you very much, Bart, and hello, everyone. It is a pleasure to be here today, and very energizing and exciting conference indeed. And I'm delighted to have the chance to speak with you all. This conversation is fairly brief. There's a lot of material to cover, and I'm sure you'll have tons of questions. So reach back out to us at info@solve.care or on the Solve.Care Telegram channel. We are always available. Let me talk about healthcare today, the most boring topic of all. But the real issue here is healthcare really, can it be improved and enhanced with blockchain? And we believe it can be, and it will be. And healthcare is a massive opportunity. It dwarfs everything else in the world. To put things in perspective, healthcare represents $8.8 trillion a year, or $8,800 billion a year in expense each year. US dominates as a single country, but 50% of the worldwide spend of $4 trillion gets spent in the US. So 4,000 billion a year. If you do the computation, it's about roughly $100 billion, $10 billion a day. The rest of the world spends about the same amount of money together. And what's really interesting about healthcare is that it is ripe for something like a trustless system. Why is that? Healthcare is really complex. Every single activity in healthcare requires coordination between parties who don't like or trust each other at all. You have typically a patient, a doctor, a nurse, a specialist, a pharmacist, an insurer, an employer, a government agency, a regulator. And they're always checking on each other to see if they can count on each other's information and data, and nobody wants to share it. So the real issue in healthcare is not just data exchange, but the lack of trust between these parties that leads to enormous cost and waste. Here's a simple fact. Out of 4,000 billion a year we spend in the US every year, $1 trillion is spent just on administrative functions, which means that's not the money you spend between doctor and patient, or doctor and pharmacy, or patient and family members. That money goes to paperwork. That goes to essentially the lack of trust that converts into all kinds of documents and administrative processes. Here's another data point. 40% of a doctor's day is spent not doing clinical care, but actually filling out forms or getting forms filled by you or I. So there is a lot of money involved in healthcare that would be saved and redeployed if we simply established a different fabric on which trust can be established without the need for all this documentary exchange. The other big problem in healthcare is data interoperability. Nobody wants to share their data. They all think that because they have the data, they own it. The data belongs to the patient, but since everybody else has copies of it or parts of it, nobody wants to give it up. Doctor has their data in their electronic medical records, hospital has it in their systems, and you as a patient have to go get it, which is very, very difficult, if not impossible. And the last thing in healthcare is that healthcare is a very complex payment model. There's hardly ever a direct payment. You go to a store, you buy a sweater, you pay for it, game over. In healthcare, that's not the way it works. You have to have multiple parties involved, the government agencies who's regulating the fees, and the doctor who's billing the insurance company, and the insurance company that's billing you. So healthcare payments are a multi-party sport as well. So all in all, I'm telling you that healthcare is very complex. I've spent 30 plus years in it. And when I learned about blockchain, I decided that this might be a way we can begin to redefine healthcare relationships. And that led to creation of Solve.Care, which is a platform to decentralize healthcare relationships. So just to give you a picture of a simple healthcare episode where a patient gets sick, these are the parties that typically are involved directly or indirectly. You don't see them, but they're always there. And all these parties have to exchange consents, identities. They have to transact with each other. They have to make payments to each other, and they have to exchange data. These are the 5 key pillars of healthcare. And if you're going to use blockchain properly, then we are going to have to tokenize and decentralize all these 5 things: identity management, consent management, transaction management, payment management, and interoperability of data. And yes, blockchain can actually add value in each of these areas. As we have proven at Solve.Care, you can do that. In fact, you can do that very, very well. We have designed a platform which is a true full stack platform on which you can define healthcare relationships, roles, transactions, gas between these transactions, payments via tokens, and exchange of data securely, anonymously, and asynchronously. Our platform is based on something called a care protocol, where you start by defining roles and relationships, and then you define the events between those relationships, and you can tokenize each event. For example, if I want to make an appointment with a doctor, I can do that in multiple ways, but it would be great if that appointment token was shareable with the insurance company so they could pay for that appointment without needing a bill, without having to adjudicate that transaction. That simple tokenization of an appointment would probably eliminate hundreds of billions of dollars a year in cost. That's just one transaction. If you could then reverse that transaction and say that I paid the doctor as a human being, and then I ended up having to bill my insurance company, if the doctor's visit was tokenized, I could forward that token to the insurance company as a proof of my appointment and get paid immediately. And that would eliminate tons of processes called adjudication and appeals. My point in all this is healthcare is very complex and it is very regional and local and regulated. But if we start to use blockchain as a fabric of coordination, and we start to tokenize those 5 entities: identity, consent, transaction, payment, and interoperability, then it becomes an incredibly easy journey to improve things. Now, healthcare will never be easy to fix. It's always going to be the last industry in the world to modernize. But given the cost and the effort and the pain involved, it is the place where we are finding greatest traction of our solution. Now, there is a really interesting concept that we invented, is to tokenize interoperability. Imagine a scenario where you are a patient and you have certain health data in your phone, whether the Samsung Health or Apple Health application has collected how many steps you walk, how many hours you sleep, and many other data elements that you are collecting. And let's say that I, as a pharmaceutical company, want to access that data. The way I would be able to do that is through a care tag. You can publish a care tag or use a standard care tag to which you can link your information. And I, in consuming that care tag, would have to pay for it using a price attached to that tag, using a digital token. You could remove access to that tag by essentially saying that certain entities with certain tokens can access your data and others can't. The beauty of this model is that we can actually tokenize interoperability, which is the #1 problem in healthcare. I used to work in many very large-scale implementations, and I was very involved in the implementation of Obamacare under President Obama, and before that, implementation of health savings account under President Bush. And we spent billions, literally billions of dollars trying to get this data interoperability to work. And in the end, it didn't. There were times when we literally would write $1 billion, $2 billion check trying to convince hospitals to share data with the patient, and we didn't succeed. Money doesn't solve the problem if the money goes in the wrong hands. But if we can tokenize interoperability, as we have done, then patients, doctors, pharmacists, insurance companies, employers, everybody can monetize the data they actually have, or allow me as a consumer to control my data no matter where it is resident, what system it's sitting in. It's a revolutionary concept, monetized on the strength of a digital token, which allows for instant payment of data that I wish to consume. So underneath all this, we have built the Solve token, which allows us to tokenize all kinds of healthcare participant functions. So when you join one of our networks, you have to pay a node fee. When you transact with other nodes, you have to pay a transaction fee. When you exchange data between parties, the consumer of the data has to pay the publisher of the data a tag fee. If there are payments between doctor and patient, such as appointment or teleconsultation or pharmacy or device or vitamins, then you have network payment capability. If you want to publish on the marketplace certain reusable components that will allow others to consume, be it a care card or be it a care protocol for diabetes management, then there is a marketplace currency. If the insurance company wants to publish eligibility on the platform and allow that eligibility to be distributed to all the doctors in a country, then they would pay a platform access fee, and so on and so forth. The idea is that a very powerful tokenized platform, which is truly decentralized and secure, is actually going to impact all elements of healthcare in a manner that people want to use. I used to be a CIO of a big insurance company. If 4 years ago this platform was available to me, I would have launched all kinds of digital health networks on this platform to manage diabetes, to prevent premature birth, to prevent suicide, to reduce cost of dialysis infections, to keep people out of homeless conditions. There are 1,000 use cases in healthcare, and they keep growing and getting more complex. To achieve those use cases, you got to have a mechanism beyond just a blockchain layer. You need a usable platform that allows me to manage identities, roles, transactions, consents, payments, and allow interoperable exchange of data. That's what Solve.Care is doing. And we're very proud of the fact that we are the first full stack platform. But more importantly, I'm here to tell you blockchain absolutely makes a difference between possible and the impossible. If we didn't have this trustless model, I wouldn't ever get a doctor and an insurer and an employer and a patient to ever agree to be on this blockchain, because none of them trust each other. So this trustless capability of blockchain, along with immutability and auditability, is what makes it possible to get healthcare parties to collaborate. And the innovation of our platform is that we can tokenize everything, be it a role, a relationship, an event, a journey, a payment, or the exchange of information between parties. And we do that through the use of care wallets, care cards, the care protocol, the care tags, all pulled together into a care network. And the value proposition is enormous. We believe that we are on our way to demonstrate billions a year in savings, and the impact is certainly significant on human and economic level. Now, the behind the scenes, tokenization of these processes is a complex game. So what I'm showing you here is how tokenization of a simple thing works, where you are trying to enable a subsidized payment to Uber or Lyft as a way to get the patient to the doctor. So you want to basically issue a prepaid Uber card to a patient who has a valid appointment with a doctor, and I as an insurance company want to make sure that the patient keeps the appointment, and want to give them a card that they can consume to go from their home to the doctor and back. That business case using tokenization and decentralization is what I'm showing you here. This is what it takes behind the scenes for the platform, but all of this is defined in the care protocol. So you can implement very complex systems, be it at a regional level, be it a local level, national level, or global level. And ultimately, the building blocks are there to design extremely complex workflows. All of this is accessed through the Care Wallet, which is a single app to connect to as many care networks as are on the planet. In every country, we expect to see their own care networks. In the US, we have launched diabetes care and a medical transportation network. We are launching a global teleconsultation network where doctors in Nigeria can see patients in Namibia, and patients in India can find a physician in the USA and do real-time transactions, real-time appointments, and real-time payments. But there are also some very interesting human use cases. We are working right now on a mental health and suicide prevention network, which is around making sure that people who need help when they are feeling suicidal have instant access to a psychiatric care, not 3 minutes late, because in suicide and depression, 3 minutes is the difference between life and death. And again, ability to transmit that need to a global chain where physicians can immediately respond with the right skill set is a really crucial skill, a capability of a system like ours sitting on top of a global blockchain. Another example of interoperability is when a user wants to share data between their networks. Let's say I'm part of diabetes network and insurance network, and my employer has a network for me. And information in one network makes sense to be shared with a participant in the other network. By using care tags, I can move data as a card from one network to the other, and the other network can figure out what it is that I'm sharing. So asynchronous, anonymous, and autonomous interoperability is what we are trying to achieve. Now, that's not just valuable for healthcare. We believe that's going to define interoperability across all sectors of economy across the world. But if you can fix healthcare, you can fix almost every other industry. Having said that, our vision is ultimately improving healthcare for you, I, and our kids and our parents. Imagine a healthcare model where you can see the doctor you want to see when you need to see them. You have access to the best health practices no matter where you live. You have control over your data no matter where the data resides. And you are an autonomous, self-sovereign human being who is allowed to make decisions about his or her healthcare or their kids' healthcare properly. And similarly, healthcare provider who can actually practice medicine without becoming a data entry clerk, and a regulator who can actually make sure that healthcare is being practiced in the right way. I used to work in the regulatory space for many years. And while regulation and regulators have a bad rep, they are needed to protect the industry like healthcare from going the wrong way and hurting the patient. Patient first, and provider must be part of that equation. So we have designed the system to actually work in the real world, and we have designed it to be fully tokenized. Solve token powers all of this. It's available on multiple formats, and we have just recently announced the availability of Solve token directly in the Care wallet, which means that we as a switch will find the right place to buy the token no matter which exchange it is being traded on that moment in time. And we have had significant adoption of our platform by major healthcare organizations, Boehringer Ingelheim, Arizona Care Network, Angel Kid Pediatrics, the California Collaborative. These are just some of our clients and partners. But the end goal here is to use blockchain to make healthcare better. And I absolutely am living proof that you can come from the traditional healthcare sector and understand all its ills and evils and restrictions and constraints. And if you really set your mind to it, you can actually make healthcare a lot better for our kids, for our parents, and for society. Solve.Care is doing that, and we hope that you will participate in this journey in one way, shape, or form. Because here's the fact: healthcare is essential. We are born into it. We're going to die into the arms of healthcare. We can have an option to play or not play in crypto, but we do not have an option not to play in healthcare. And using blockchain to make that better, that's our mission. And we are very excited that you are here to be part of it. And we invite you to listen to join us and contact with us and reach out to us if you have any ideas or needs in your economy, in your society, in your country, in your region, because I'm quite certain there's something we can do together. Thank you for listening. We look forward to hearing from each one of you, and have a great day.